Did you know that not all spinal decompression treatment protocols are created equally? What matters most is the positional setup on the spinal decompression table, which can dramatically influence the effectiveness of the treatment for the L4, L5, and L5-S1 disc herniations. Now, if you are suffering from back or leg pain because of this L4, L5 disc herniation or an L5-S1 disc herniation, this will be an important video for you to keep watching. But I have to warn you, this will change everything you thought about and knew about spinal decompression treatment of L4, L5 disc, L5-S1 disc herniation problems. So in this video, I'll show you how non-surgical spinal decompression treatment is enhanced with targeted positioning that is specific not only to the location of the disc problem, the disc herniation, such as a posterior lateral or central, but also to the patient's symptoms, including the location of the leg pain, whether it's above or below the knee. When done right, non-surgical spinal decompression provides a true and long-term solution to lumbar disc herniations. We're going to break it all down in this video. You will finally have a comprehensive understanding of how non-surgical spinal decompression works, the uniqueness of positional setups, and you will be equipped to know how to discern which treatment options are best suited for your specific condition. And most importantly, you will finally find a path to resolution and permanent pain relief from an L4, L5, or an L5-S1 disc herniation. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. With over 24 years of clinical experience, we have helped thousands of patients recover from spinal conditions like disc bulge, disc herniations, disc degeneration, lumbar stenosis, sciatica, and radiculopathy using our unique and proven back-to-life method. Be sure to hit that subscribe button if you want more tips on how to get relief at home from sciatica and disc-related pain, and to learn which therapies actually work for these conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link pinned below in the comment section. So before I show you how non-surgical spinal decompression treatment is enhanced with targeted positioning, let me first review briefly what spinal decompression is and how it works, what needs this, and why this treatment is really specifically for the disc problems that are occurring. So in these examples here, right, we have the discs that are healthy, are full, they're vibrant because they've got fluid that's coming into the disc in and out, and that fluid exchange is what plumps the disc up enough to create space for your nerves. But as time has gone on and the disc has degenerated, early on it's getting compressed and losing fluid. But if it stays that way, now we're getting into these conditions that have passed either bulges into herniations. And basically the main thing I want you to understand is that discs have desiccated, dried out. So when it's dried out, this is a loss of fluid problem. It's not that the disc has worn out like a knee cartilage. This is a different situation in your spine. So as it's being compressed, we've lost fluid, and that's what's really drying out and degenerative effects. The bones are compensating for a lack of disc tissue. They're thickening up because you have basically dried them out. So obviously there's a limit. We want to get this at the right time. When you're at a bulge or an L4, L5 disc herniation, it's basically come to the point, like an example here is a sponge that's dry and compressed. So what we're going to do with decompression is we're going to take that pumping action is going to create fluid is going to come back into that cartilage. It's going to basically plump back up, right? So now there's a soft tissue in that bone joint in between the vertebrae, and you're healthier again, actually correcting the cause, and the nerve is free because those discs are healthy again. So that's the real effect of spinal decompression. So we have specific tables for this specific treatment of spinal decompression, non-surgical spinal decompression. These tables here are the DOC brand, the Doc brand table, as you can see. And why I have these tables more than any other tables on the market is because they're uniquely, specifically designed to create positional decompression. So that's what we felt was the most unique thing on the market. These tables are the latest technology. They're the smallest computers, and and they basically allow us to set up a patient in a variety of positions to get the best results in the fastest way. So how that works is basically we have a computerized setup. Donna here with different leg heights to target the level of her spinal disc condition. So for example, when it's L4-L5, disc bulge, we're going to go down to that level. When it's higher in the spine at L1-L2, for example, the table is going to target specifically the exact level of spine problem. So that's really the main purpose of this table and makes it unique versus just a flat spinal decompression. So those of you that have had spinal decompression and think you've had true spinal decompression, the difference is the targeting makes all the difference. So when we have this going, whether it's up or down, so when I can put Donna in the opposite direction here, would be for someone who has lack of curvature in their spine and we want to decompress and arch your spine at the same time. There's so many variety of ways that we can target this. Otherwise, the other examples we use is that for a person who has pain down one leg, we can specifically, if she has it on this leg, I can move her away from that side to create a greater pull into her disc condition on that side to help pull the disc back. So what I talked about earlier, that we're creating fluid coming back into the disc, we're also helping that disc bulge come away from the nerve root. So by angling her, we're getting the best of both worlds in that positional setup as well as decompression at the same time. Now, some of the other treatments that are very effective, if we bring someone up all the way. So this is for someone who has spinal stenosis, spondylolisthesis. We want to flatten that curve, helps the spine actually come back over the tailbone in this case, and that spondylolisthesis can be relaxed and pulled away from the spinal cord, as well as spinal stenosis, right? We're getting that spinal disc to come off of the main spinal cord with that condition. So the variety of setups are endless on this. I would imagine there are hundreds of ways to really get this positioned in a way for a patient to get the best results. The last option we have is rotation. So even rotating, if there's a twist in the spine, it's all specifically going to get to your spinal disc condition. So that's why this table is the best on the market, in my opinion, and the most unique in how it creates the best results. So how do we determine what position to set up a patient? And that's obviously varies between every single patient, right? When it comes down to it, we're going to take in factors such as how do you feel the pain? As I mentioned, if it's going down one leg or the other, basically your MRI, that is something that's really specific to check a disc condition. But we don't only necessarily need an MRI. I can see an x-ray. We send all our patients for x-rays prior to starting treatment so we can look at their disc heights, look at which levels to target, and it's very obvious after years of experience looking at these films. I actually like to show you and my patients what exactly is wrong with the spine and where it is. So we'll take a pre and post x-ray, and that's how we can tell the results are actually being achieved. Obviously, symptoms matter, but also the x-rays give us the final yes or no of how great it's doing. So those are the things that help us determine. Obviously, basically every time you come in, we're going to talk and say, well, was it better down the leg? Is it, how do we will change these positions every session if we need to, and we're going to find what really gets the best results. Each patient has one position that we find really gets them that aha moment. It's when things really feel they've gotten a big relief on the next visit, they come in feeling great. So that happens over a series of visits, and then it occurs in one magical visit sometimes where it feels like it just really opened up. And that's the effect of spinal decompression. It's taking that disc bulge or stenosis off of the cause, and now we're getting the relief we're looking for. So what also makes this table unique is the individual computerized programs that are going to cause the best results. So what I mean by that is based on again, those MRIs, those x-rays, we know whether you have a disc bulge, a disc herniation, if you have spinal stenosis, spondylolisthesis, right? Each one of those has a unique protocol on our computerized tables that's going to get the best results in the safest way. So if you have a disc bulge or an L5-S1 disc herniation, we're going to use what's called a K1 program. It's going to basically hold for longer periods of time. What that means is we apply force based on body weight. Each person's weight determines how much pounds the table is going to pull. It's going to warm up the spine over a series of gentle pulls, and as it pulls that disc, it's very safe. It's going to basically hold, shut off some of the muscles along the spine, and relax again, and then pull a little more each time over a sequence. The ones that have spinal bulges, the ones that have spinal degeneration, those have different protocols. Bulges and herniations, we're going to hold, let it hold for a while so there's a vacuum effect. The point of spinal decompression is to create a negative pressure at the disc. A negative pressure is like a vacuum effect. It's going to suck those bulges and herniations back toward the center of the disc, and that's going to create that relaxation at the nerve root. And ones that have degeneration, those that have osteoarthritis in the spine, basically they've had degeneration that it's dried out, like we showed there more, that needs a little more often the pumping. So the computerized program is going to have a sequence that pulls, relaxes more throughout. Basically a 20 to 25 minute session is the time frame that this builds up and comes back down. So every session, after each session, when you come back and we talk about it, I'm going to hear from you, oh, it was a lot better last time. The position helped, the program helped, and now we're either going to increase how many pounds we use, whether it's 2 pounds, 3 pounds, we're going to vary that. And if it still felt great and doesn't need any more pounds, we're going to leave you at that and let this work over time. So the key thing with decompression is it's a series of visits that builds up, getting you to a maximum pull, and it's all gentle and computerized, and then it's going to come back down over the visits, reducing frequency, getting you into maintenance decompression so this problem stays corrected over a longer period of time. So that's really how spinal decompression tables, especially this table, have specific programs depending on your condition. So what this treatment has meant for countless thousands of patients in our office, I can't even begin to tell you how many success stories that we've heard. The success rates, first of all, are basically 80 to 90%, and that's what the studies have shown. So countless studies that we've talked about in other videos have been done by the Mayo Clinic and other high-level facilities that have seen great long-term results. The disc is not only being pulled back and not just temporarily relieved of pressure, the effects are larger discs and 90%, 80 to 90% success rates means thousands of people have avoided surgery. One of the patients that comes to mind is an airline pilot, major airline pilot who's worked with us over a period of time. He came in very frustrated and very concerned about his condition was stopping him from flying flights. And he, over the term of the treatment, had seen significant improvement, getting back to training other pilots, and then eventually getting reinstated to be able to fly again, and he couldn't be happier. But the MRI was done initially. The surgeon had said, you're probably going to need surgery, and he was very scared and cautious about getting surgery and potentially losing his career, his livelihood. And by doing this spinal decompression in the specific ways that we've talked about, targeting his discs, he was able to achieve that and get back to life. And basically that's what we want for all of our patients. So if you want to see that story, it's on our YouTube channel to see that video as well. So the other unique thing about our office, and those of you that said you've tried spinal decompression before, or you've been to clinics that have traction tables, I want you to understand there's a difference. So not only is position matters, but the programming that we're talking about. Spinal decompression, true spinal decompression, is very different than traction. So traction, for just so you know, is as a table that holds, basically it pulls open the spine and gives a deep stretch, but it doesn't really come back and forth like the computerized programs that true spinal decompression has. It's basically like hanging with an inversion table. Those of you that have had or seen or used an inversion table, all that's doing is helping you hang a bit upside down. The muscles are being pulled apart, but muscles don't like to be pulled apart. So when you're pulling apart with a traction table or an inversion table, it's basically muscles are going to resist that, and it's going to fight and create tension in the muscles and never really get deeper to the disc condition and get to the disc problem. The difference with our spinal decompression, true spinal decompression, computerized decompression, is pulling, relaxing, waiting for muscles to relax and shut down, even going back to a lesser pull. So the muscles think, okay, it's done, and then it's going to go past that point and slowly create a negative pressure at the disc level. So we're actually going to get the results we're looking for that are long-term because your disc is getting treated. So that's what I want you to understand, is there's a very big difference, even if you've had decompression before, how you position, how long these pulls are for, and true decompression is going to be very different than anything else out there. You now have a thorough and comprehensive guide on what spinal decompression is and why positioning matters in the treatment of an L4-L5 or an L5-S1 herniation. Should you have any questions about non-surgical spinal decompression, ask me in the comments below. I also want to hear from you about what treatments you have tried that worked well for you and which treatments didn't work for you. You're not alone on this journey. Let me know in the comments section. Now, if you have found value in this video, please be sure to like and share it now. And go ahead and subscribe to my channel now if you want more tips on how to relieve sciatica and disc-related pain and what treatments actually work for an L4-L5 disc bulge. Now, the next video you should watch is this one. If you want 5 unique and easy exercises for relieving pain from an L4-L5 disc bulge, go ahead and watch this video here to follow these exercises.